It's nice to see you all here. So this is the second Menopause Cafe that we're running at OMC. And today we're going to be talking about the risks associated with HRT, as this is a great concern for women when they're deciding to take hormone replacement. One of the first and most concerning of these risk factors is that of breast cancer. And women often think about it, they want to discuss it, and it's really a good time during a consultation to discuss the risks of breast cancer linked with HRT use. And majority of this evidence around breast cancer risk comes from a study that was carried out years ago, WHI, or Women's Health Initiative, and it basically looked at the risk of breast cancer in women using Premarin, which was a synthetic estrogen, and progestogen, which is a synthetic progesterone, and it showed a small increased risk in development of breast cancer in those who use HRT. But things have changed in the treatment of menopause quite greatly, and now majority of menopause specialists use biologically identical hormones, which have chemical structures identical to what a woman's body had made before her menopause, and therefore the body should really know how to process these hormones, and there are less risks involved with them. As regards to breast cancer, there are multiple factors that come into play, and these are listed here. Some of them are listed here. Genetics, so a woman's family history of breast cancer, BMI, which is the body mass index, which is calculated by dividing the weight in kilogram by her height in meters squared, and the normal range is anything between 20 to 25, sort of persistent or daily use of alcoholic beverages and smoking. And in this slide, this is a very good visual demonstration of understanding risks of breast cancer that was published by Women's Health Concern, which is a sort of patient arm of the British Menopause Society, and it explains visually the risk of developing breast cancer in general population, and this is the incidence per 1,000 women between the ages of 50 to 59, and different factors which could change this risk, either increase it, which is demonstrated by the darker red figures, or reduce it, which is demonstrated by the light green. And as you can see, being overweight or having a body mass index of more than 30 is the greatest risk to increasing breast cancer incidence. And with that, having 2 or more units of alcoholic beverages every day and being a smoker greatly increases the risk, far more than using HRT. And in fact, you know, in the third line down, you can see that there is a reduction in that risk when a woman takes only estrogen. That's bioidentical estrogen or estradiol. And the one above that, which shows an increase of 4 cases with combined HRT, that was in addition to the estrogen, that was progestin, which is the synthetic progesterone used. And on to the next slide. This slide is here to demonstrate that there are many different kinds of breast cancer. And although they all come under the umbrella of this, breast cancer, but they act and they function and they behave very differently, and their treatments are often different as well. So the breast cancers that have estrogen receptor negative, so they don't have estrogen receptors on them, the use of HRT has really very little bearing on the outcome and mortality rate of this group. And those who have estrogen receptor positive, again, there is to date no strong evidence to show that there is a change to mortality rates with use of HRT. Vaginal estrogen, of course, is very important for a woman who's postmenopausal or has symptoms of estrogen deficiency, like dryness, irritability, itchiness, and you can comfortably use that even with a history of breast cancer, because there's very little systemic absorption of it. Another risk factor, which often women think about or they're discussed with when they're contemplating HRT use, is that of blood clots. And there's a lot of misunderstanding around there, because historically women have been put off using HRT if they have a higher tendency to form blood clots or they've had blood clots in the past. But of course, we know now that using a transdermal, which means through the skin, estrogen doesn't really have extra risk to development of blood clots, and it's very safe to use estrogens in the form of cream, gel, patch, or spray, because it doesn't go through the liver, it's not ingested, and it doesn't really increase the clotting factors. There are, as well as different kinds of estrogens, of course, there's different kinds of progesterones. So there's synthetic progestogens, which can increase the risk of blood clots, as do the orally ingested estrogens do. And then there's natural or micronized progesterone that don't really increase the risk of blood clot. So it's important for a woman, especially those who have a risk of increased risk of forming blood clots, to be under care of a specialist who understands these different forms of HRT and how they act, and that they're not denied unnecessarily the HRT, and they can still benefit from it. So here's some myths, and we're on the left. I've put some comments that I hear often during consultations, or from generally from friends and patients. And then on the right-hand side, there's the facts. So if you've ever been told that you can't take HRT because you suffer from migraines, and due to the fact that increases your risk of developing a stroke, or that you can't take HRT because your blood pressure is too high, or that you've been on it for 10 years, or you've reached the age of 60 and therefore you should stop it, they're all false, and you shouldn't. You should really challenge that decision. You can definitely and safely take a across the skin estrogen, especially if it's a biologically identical or body identical estrogen. And reaching hormonal balance can reduce, we know that for a fact, it's evidence-based, that it reduces the risk of cardiovascular disease. It helps to motivate the woman to have a healthier lifestyle, and therefore help to reduce her blood pressure, and also to reduce her bad cholesterol. And there's basically no need to be scared of HRT, but what needs to happen is for the woman to be assessed and advised correctly by a specialist who knows about HRT and menopause treatment. It's been great seeing you here, and hopefully we'll see you all next month for another cafe.